Hello, everyone, and welcome to RestartED's virtual town hall. This is the third in a series of panel discussions with educators devoted to rethinking, reimagining, and restarting our schools. My name is Greg Tafaro. I'm a reporter with USA Today Network, New Jersey, and I'm honored to moderate tonight's discussion. Those of you joining us once again, welcome back. Those of you participating in our town hall for the first time, thanks so very much for being here. RestartED is a dedicated group of New Jersey-based educators. Their focus is on reopening schools amid the coronavirus pandemic and modernizing education through dialogue and action. Their goal is to improve the collective capacity of educators to serve students, staff, and communities. The focus of tonight's panel discussion is on the best practices for mitigating health risks as state departments of education and school districts across the country work to safely reopen schools. Our national panel of school nursing and health experts in alphabetical order includes Michael S. Kelly, Loyola University, Chicago, Professor and Director of the School Mental Health Advanced Practice Certificate. Lisa Kern, Pasco County Schools, Florida, School Health Supervisor. Jay Micah, Superintendent, Matawan Aberdeen Regional School District, New Jersey. Mary Beth Mioto, Worcester, Massachusetts, Associate Medical Director of Pediatric Population Health. And Liz Prey, Moses Lake School District, Washington State, President-elect for the School Nurse Organization of Washington. Thank you all so very much for being here. To say that the combined experience and expertise of this group is amazing would be an understatement. If you've yet to already do so, please take a minute at the conclusion of this webinar to review the extensive biographical sketches of our panelists. A link to a press release containing that information can be found in the chat room or on social media at RestartED's Twitter handle, which is @RestartEdTeam. Joining us in cyberspace from the chat room and on Twitter tonight are David Adderhold, President of the Garden State Coalition of Schools and Superintendent of the West Windsor-Plainsboro Regional School District. Scott Rocco, President of the New Jersey Association of School Administrators and Superintendent of the Hamilton Township School District. Mike Salvatore, Superintendent of Long Branch Public Schools and the 2019 New Jersey Superintendent of the Year. And Dr. Charles Sampson, Superintendent of the Freehold Regional High School District and President of the Monmouth County Superintendent's Roundtable. They'll be monitoring your questions and feedback in real time. Throughout this town hall, the panel welcomes your questions and encourages you to share ideas as we create a collaborative atmosphere designed to strengthen education. The following preamble from David Adderhold, which precedes his comprehensive list of more than 75 public health questions regarding school reentry, nicely frames tonight's topic. And I quote, "As reopening strategies are being contemplated, health and medical guidance must be provided. We do not need suggestions or considerations, clearly articulated guidelines that serve as an industry standard and are applicable across workplace and schools, grounded in science, must be provided in order to ensure the public health. If we get this wrong, people die. Our staff and students will be placed at risk. Our families and school communities will be placed at risk. Our students and staff deserve the highest safety standards. The absence of clear and concise medical guidelines from state and federal officials is analogous to medical malpractice," end quote. Data suggests David's words are devoid of hyperbole. More than 8.2 million people worldwide, a quarter of who are Americans, have contracted the coronavirus. COVID-19 has claimed more than 444,000 lives, including those of more than 117,000 Americans. 10 states are currently seeing their highest 7-day average of new coronavirus cases per day since the pandemic's onset. With the mortality rate above 5%, precautions and continued vigilance are needed. On that somber note, with the proper context and perspective having been provided, we'll commence this week's town hall with some questions for our panelists. And I'd like to work around the table by way of introduction. Based upon each of your specific areas of expertise, what are some of your main concerns regarding school reopening this fall? And Lisa, I'd like to start with you.
So I guess my perspective, I'm a supervisor for school health. In a reasonably large school district, we have about 76,000 students. And I would go out on a limb and say that my biggest concern is the guidance that is coming from the CDC with regard to the use of masks in schools. I believe there is some parsing of whether or not that's advisable from a state-by-state perspective. I think Florida is one of those states where it is suggested, but I know other states are requiring it. So I guess this sort of up in the air approach with regard to mask use is something that I'm very much concerned about. I know there are some children that will not be able to wear masks, that's for sure. We have some very medically fragile students. We also have some students that are from a behavioral standpoint unable to do so. But for those that can, and also for employees that I have specific concerns about, those that have health conditions and are older, I would have liked the CDC to come out with some definitive guidance with regard to masks.
And Liz, if you don't mind weighing in, what are some of your main concerns regarding school reopening this fall?
Sure. Thank you, Greg. So in Washington, one of the biggest concerns that we have is there's several of our rural districts that only see a nurse once a month. That's going to be a huge concern in Washington. I think the lack of nurses and the ability for our students to have access to a nurse is going to be a problem. I agree with Lisa and the face coverings. You know, that guidance needs to be more specific. The information that we have coming back or that's out in Washington says that students and staff must wear a mask or a face covering when we do go back to school. There are those exceptions if there's a medical note or something having to do with behavioral health or a legal concern, you are able to get a waiver for that. You've got the high-risk staff. We've got to have a plan there, you know, high-risk students. There's just so many things to consider as we're coming back.
Thank you so much. And Jay, I'd like to pass the ball to you now.
Yeah. Well, I'm a little smaller district than Lisa. We have about 4,000 students, about 350 staff, and a lot of what was just said, I would echo, and a lot of apprehension about opening a school in a state that has given us no direction so far as to how to accomplish that. I'm extremely concerned about those staff members with pre-existing conditions and those students that have pre-existing conditions. You know, what are the parameters? Right now, we have no parameters to work around to even begin to make some kind of plans to accommodate for all of those things. And as Liz and Lisa were saying, you know, just the discussion of masks alone, which we had hit on last week, the cost alone of that is astronomical. And how do we accomplish that? And I'm intrigued by Liz's point in a place like Washington where they might not see a nurse every day. So for instance, in New Jersey, we do have a nurse in every building and we're very, very lucky to have that. But I could not imagine being in Liz's position where you might not see a nurse. I don't, you know, from a moral, any perspective, how do you open up a school in the middle of a COVID epidemic without nurses in the building? It doesn't make sense to me.
Thank you, Jay. Mary Beth, would you like to weigh in, please?
Sure. every single one of those considerations is a concern for most pediatricians in the country. I have a slightly different view, as much as I think we need to answer every question that has been brought up. I also think that if we don't have a concerted, at least a locally concerted confidence in the prospect of how we reopen schools, we lose the confidence of teachers, administrators, parents, and the community, and then we have unintended consequences. And the unintended consequences of school absence concern me as well. And that would be that kids with special health care needs, children from underserved communities, the adults who are taking care of them and are concerned about their social emotional health. I worry about those kids who get much of their health, their nutrition, and their education only at school. So when I think about kids with autism who are at home, they can't access the great services that you all provide every day. The kids getting speech therapy, even kids who have trach or other technological assistance, we need to come up with guidance that puts everybody at ease. And the uncertainty is what I think people are struggling with. I don't think we're going to have all the answers, but we need a scaffolding to make people feel more comfortable so that parents feel comfortable sending their kids to school and the schools feel comfortable receiving those kids.
Greg, if you don't mind, if I could just dovetail off Mary Beth for a second. Mary Beth, that's a great point. And just as an example, last week, our governor opened up the extended school year program and basically equated it to opening up our summer camps outside. And it's just not feasible. You're talking about our highest needs children that often have many, many medical issues. And I could not agree with you more. But that's the guidance we have of today for ESY that is supposed to start in a few weeks.
Yeah. And I'm in Massachusetts, and we've had interim guidelines, and we're, I think, a half a step behind you all in New Jersey. So I think
I don't know about that.
Each other. The country's looking at each other, but step by step.
Michael, like to get your input. What are some of your main concerns regarding the reopening of school this fall?
Sure. And hi, everybody. My name is Mike Kelly. I'm a professor at Loyola Chicago School of Social Work. I was a school social worker myself for 14 years. One of the most important work I was ever able to do was because I had a school nurse with me every step of the way. So big shout out to all nurses and other related service professionals. I run a website called schoolsocialwork.net. I put some links to it in the chat already. I run a social media platform called School Social Work Network that has 4,600 practitioners on it. And we've been having 3 lunchtime live chats from April 1st in this pandemic until last Friday, June 12th. And I'll speak to what I've learned from the practitioners over the course of this hour. But in addition to that, we are doing a national survey. I do survey research. So we're in the field right now. We have about 1,000 responses. We're going to close up at the end of June. So to answer that question without doing typical professor paragraph talk, the first thing I would really want to emphasize is that we, as much as we need to get procedural and very concrete, we need to step back in this moment and ask, why don't we have guidance? Why is this a country that is so uninterested in public health and mass solutions in a way that other countries have already figured out? We are being an exceptionalist country in a way that's extremely dangerous. And we have a strong belief and ideology really in that. We're going to see that play out all summer. We're going to see it play out when schools reopen. I think all of us on this call would probably be comfortable with masks, would be comfortable with washing hands, would be comfortable with social distancing. Those appear to be 3 of the main things we can say work. How many of us are in communities where that's not being practiced right now by the adults, let alone the kids?
Right.
And the defiance that's coming with that. And, you know, I'm new to this group and I don't mean to politicize us unnecessarily, but we are in a very flashpoint moment where people have been inside essentially for three months in some states like mine, Illinois. Other states just reopened because they kind of felt like it. And we're about to have a school year start with a lot of parents who I think have very rational, real reasons for wanting their kids to go to school, both educationally and because they don't have childcare and all the other issues that come with it. But one of the things I guess I want to push back on that is going to come up and that I want to kind of shoot down a little bit is there's this interesting development. I follow a lot internationally what's going on, and there's a lot of people that have kind of called for schools to reopen because kids' mental health is being threatened. And I really want to problematize that, to use a big fancy word. I apologize in advance. Opening a school without having the plans we're going to talk through tonight is itself a traumatizing experience. Mm-hmm. We are going to traumatize young people. Beyond that, we won't serve a lot of the special needs kids we're going to talk about tonight. If we don't do this right and do this well and do this with the confidence that several have spoken to, I'm more worried about that than kids who are feeling lonely and depressed at home. I mean, that's real too, but we cannot get that wrong across the country. And I'm really worried we will because of the way we approach education and the way we don't do public health in this country. So those are my kind of meta concerns. I think we actually know a lot based on what's been said in the write-up and what people have already started saying tonight. I think we have a lot of things we could actually do that are pretty concrete and coherent. Mm-hmm. I'm not sure we're going to do them. And I'm not sure that the people that write the checks and have the power are going to let us do them.
Really well said, Michael. Jay, just to double back to a point that you had made, dovetailing off of Mary Beth, Scott Fetter, Superintendent of Schools here in South Brunswick, New Jersey, wrote a wonderful, impactful open letter to Governor Murphy here regarding the New Jersey Department of Education equating summer camp to extended school year. I'm hoping one of the moderators might be able to post that link in the chat room. I apologize for digressing, but it's an important document to share. Lisa, you had mentioned about masks being optional, let's say, and I'm curious, the guidance of most state reentry plans and health guidelines appear more as recommendations and considerations. So for you, what are your non-negotiables as you contemplate reentry?
Well, I think face covering should be required as you walk through the door, along with hand hygiene as an entry point. I think social distancing should be part of our plan for setting up schools in a safe manner. I think that all of these things are something that we have to teach, both not just students, but also staff members. Mm-hmm. As someone mentioned, it's difficult to get compliance from an adult standpoint. So we have to model that behavior for students. So I think that those are, and the possibility of staggering schedules would help with the large numbers of students. As you can imagine, with the numbers of students that we have in a school district, and Florida has some pretty large school districts. So there has to be options for parents too. I know there's going to be parents out there that are going to decide not to send their child to school. And I think allowing schools to identify that ahead of time, factor in that from a planning standpoint, I think that's a lot of, that may be part of the reasons why it's difficult to plan, because we really don't know how many students are going to cross the threshold. And how do you plan for that when you don't know how many students will be there on a given day? I know there are some districts that are doing alternate days for kids, so that seems to be a workable solution for them. And there are some that are, and there's many different possibilities in terms of solutions out there. But I think all of the non-pharmacological interventions that we routinely talk about, you could go to the CDC website and see them. That has to be part of the day-to-day process in a school. Kids have to wash their hands on a regular basis. Adults do too. There has to be times for that to be done throughout the day to keep kids safe. We have to be also cleaning high-touch areas within the classroom setting, and especially a process when you have secondary students where they'll share classrooms and desks. What's the process between one class and the next to keep kids safe?
One of our participants asked a follow-up question as you responded to my query. How do we keep face masks on pre-K 3 to 5-year-olds? Not an easy task. It's probably more rhetorical than it requires a response, but.
Yeah, I think we're not going to do well with that. I think that there are opportunities for teaching, and then when you have groups of students at that age together, they will each want to do what the other one is doing. So if the teacher is taking the lead and modeling that great behavior, there's an opportunity for that to be successful in classrooms. And I think that when you teach little kids about safety and how important it is, they'll get it. You will have students that will not be compliant no matter what their age is.
Could I actually add to that?
Yes.
I have actually been practicing and seeing kids since the beginning, or almost the beginning, I think a week in to COVID, starting off with infants and going up to 5 years old. For well child, actually, I was setting up clinics that way. So we know that the smallest children, we don't want to wear masks anyway. And I do think that Lisa's totally right, because I see these kids want to put masks on at age 2, at age 3. And I'm in an urban community with a lot of families that are essential workers. So it's a little bit different family-wise, that they have seen illness in their communities.
Yes.
But I would also say that the CDC, as much as there are gaps, every few days, new guidelines come up that are helpful. There are helpful things, and it's very hard to sort through it. But if we think about kids who have behavioral issues or are young, there are alternate ways to work with the mask issue. I feel like the numbers of masks provided are going to be a major barrier to schools. However, because little kids will get the masks dirty, but as far as wearing the masks or spacing, we can use some of the childcare guidance that we've also gotten, and that gives some ideas on how to keep kids safe who aren't wearing masks. And I don't want, as much as I want really practical solutions, I think that I've seen very positive behavioral changes in a high-risk hot health center in the middle of Massachusetts, where people were really nervous. And there are some basic changes that have helped a lot in disease transmission in my health center with families coming in. And 18-month-olds touch everything, 3-year-olds touch certain things. And that made me a little nervous. I got all the waiting room chairs gone and things like that. But I think that what everybody's asking for are those basic pillars of safety that we want. And I do think that we're starting to build those. And the mask wearing, I believe that over the summer, we can normalize it in some districts. It really does come up with that whole issue of the culture of the adults in the district.
Yeah.
Mary
Can I
Beth.
say just to that, like a really powerful thing you just said, Mary Beth, I think it's really important, is it is really about the developmental stages the young people are in, right? And what's so great about this panel and the efforts being done with this working group and these webinars is we have to devolve as much as I'm really hot about what isn't happening at the federal level and the state level and politically and all those things, I'm also really keen that we have a bottom-up approach to this, where the people that are closest to these kids are really designing the delivery of a reopening plan. And that needs to be certainly my little discipline of school social work, school nurses, teachers, principals, certainly obviously are going to be central to that. But you know the grade level of the kids you're at. You know what their version of needing social distancing is going to be. You'll know what are the real issues that are going to come up just even in the physical plant of the building. And I think if we have a plan that cuts that way, I think parents and kids will feel safer. But if they perceive it as something that is either just kind of evolving or is, coming down from on high to whatever degree, I think that's where we're going to see a lot of lack of confidence as well.
If I could just throw this out to the group, because I would like your opinion on this, with what both Mary Beth and Michael said, that's fine. However, what about the staff member who's in that room and is apprehensive about a student that doesn't have a mask on? How do we go about that education process and things like that? Because that's going to happen too, because you know, we have our students and we have our staff, and we have to be concerned about everyone's well-being coming back. And, you know, I would be curious to see what your take is on that.
So for me, we've already been doing some planning. How are we going to protect staff who have to be up close and personal with medically fragile students? And it's all about personal protective equipment for those folks. Use of masks and also face shields, possibly needing to have a gown on, or alternately a change of clothing if that's necessary. But these are kids that we are providing basic needs on a regular basis. And a lot of the folks that work with these students want to get back to that work again. They miss it. They miss their kids terribly. And knowing that, like Liz was talking about lack of school nurses. In my county, a school nurse has 2 schools, sometimes 3, depending. We have folks that we train, but they're unlicensed in our school clinics. But out in the classrooms with medically fragile kids, we have licensed practical nurses, and they're the ones that are providing and seeing those kids on a day-to-day basis and providing their care, their G-tube feedings, their trach suctionings, etc., toileting needs. So I think if we're thoughtful about what those protective mechanisms we need to have to make those folks feel safe, I think that's an important part of preparing the classroom, not only from a physical distancing standpoint, but also to make sure that you're putting safe personal protective equipment in place for those kinds of classroom events.
Right. And Lisa, I would even take it one step further when it comes to transportation. You know, what about those bus drivers or those aides on the buses? You know, I agree. And it expands as we discuss this. It just gets larger and larger.
Well, and we have requirements for accommodations for workplaces. And we do need to be 100% sensitive to that and try to take some of the learnings that we've had in healthcare. You know, don't think that just like in schools, nurses, doctors, staff, every level of worker in a healthcare situation, we have the same mission as educators have and all the people working in education, but that doesn't mean that people don't have health needs. So we definitely have to, on a case-by-case basis, educate and listen to the needs, because I can even just tell my own story. I had a lot of medical needs. I did not feel in harm's way, but every one of my older siblings was torturing me not to see certain kinds of patients. So there are a lot of invisible medical and social reasons that some people don't feel comfortable, and we need to respect those and give them opportunities, whether that be that they support virtual learning, whether they can, we'll have break rooms that are different. There are so many levels of nuance, but it does necessarily mean that we respect and we legally are obliged to protect those workers.
Yep.
I've got a 2-part question for Liz. I'm sorry, Jay.
I was going to say, I think Liz had something to say. I just wanted to make sure.
Well, and I was going to say, I sat on the reopening committee at the state level, and we talked about different options for school districts to explore as we were thinking about coming back. And they included continuing the digital learning, a modified version with bringing students back into school, plus using a digital learning, because we understand that there's going to be parents that aren't ready to send their kids back, you know, and we understand that there's going to be staff that are high risk and they're not going to feel safe coming back yet, you know, so there was options discussed when we were putting out those guidelines at the state level for the districts to consider. So,
and when you put those guidelines, sorry, Greg, go ahead.
That's okay, Jay.
when you put those guidelines out, you have suggestions on how to accomplish these things in those guidelines?
You know, they left a lot of those decisions up to the local school districts working in conjunction with the local health districts, you know. So our State Department of Health and Labor and Industries, along with OSPI, put out guidances and different things to consider and look at, and then everything went back to the districts to make a decision.
And I think that comes back to what Michael Kelly said, is that just like we know the developmental levels of our students and the people, the kids around us, the families around us, it's a really hard act to sort of follow, in that the CDC and then state advisory groups are trying to give some structure, but also leave it to the municipality, so that it could be that some districts do not have the financial, geographic, or nursing resources to look like the district next to them. And so it's very hard. I know the CDC guidelines keep saying if feasible or where feasible. And that's scary in some ways, but I think that we have to, at each of our districts, own that we are learning and that we know our community best. And there may be hard lines that some communities can't open as quickly because they don't have the resources, and we need to push back that not every community in a given state can do what the state guidelines say, but it's where feasible.
Liz, I've got a two-part question for you that comes from one of our participants. How do you anticipate the role of school nurses might change during reentry amid the pandemic? And also, what are some of the additional responsibilities with which nurses may be charged?
You know, we have been looking at that stuff, you know, at both a state and a local level. As a nurse, I can totally see our role changing going into school this fall. But at the same time, we've still got immunizations to worry about. We've still got our state mandated screenings to worry about, our emergency health plans, all of our staff training that we normally do. And then on top of all that, you toss in the fact that we're in the middle of a pandemic. And now we're having to screen everybody every day, not only staff, but students. We're having to go through and worry about teaching physical distancing. We are reiterating our hand washing, which we normally do anyway, but face coverings, and there's just so many different pieces that are coming at us. And our job is, any nurse knows that your job is revolving all the time, but it just seems like when you get a handle on something, the guidance changes and things change for us at the local levels. So it's going to be a learning curve for sure. And I know that we're going to figure out a way to get through it.
As a follow-up to that, and this is for any member of the panel, perhaps Lisa may want to weigh in, and Liz again, what modifications to the nurse's office should be made due to the pandemic? And one of our participants added, administrators are talking about an isolation area inside the school nurse's health office. A drape screen is for privacy, but not isolation.
So yeah, so I get the pleasure of supervising about 44 school nurses in my county. So I'm a registered nurse by trade. And the CDC guidelines do recommend that we identify an isolation area separate from a school clinic, where we could locate students or staff members even that display COVID-like symptoms, because we really don't know what they have. We're just basing it on symptoms, right? So logistically, it could be a nightmare, I think, for the folks in education, because that not only requires another place, and sometimes room is an issue in schools. But it will also require some level of supervision from someone, because we can never leave children unattended. So we have the regular clinic activities going on, which is I have to give medications. I have to, fix whatever injury might come through the door. Children will still be coming to the clinic for all sorts of reasons. One of the things that you could do as a school nurse is to spend some time up front with faculty and staff to talk to them about what should come to the clinic and what shouldn't come to the clinic. There are there's possibilities of having teachers, pod areas, take care of little things so kids don't have to traipse down to the clinic and be unnecessarily exposed. And then we may need to train others to provide support with the medication and the first aid issues, while the trained person who's wearing the gear, right? Because again, I've got to protect that person. So I've got to put mask, face mask, gown, possibly with the folks that are not feeling ill until they can be picked up.
Hey, Lisa,
So,
can I ask a question? In creating these isolation rooms, do you have any issue that HIPAA could be a problem? If someone goes in there, what the assumption becomes, and someone walks by and then, oh, so-and-so is in the COVID room,
yeah,
I've given that some thought.
sure. Yeah, the less traffic we have there, the better off we are, right? So teaching educators to limit the number of students that get sent down to that location, to the clinic area. That I think that issue of confidentiality is always one when it comes to clinic visits in general.
Yeah.
In some clinics that are big enough, there could be an area of the clinic that could be set aside just for kids that you want to isolate. It would be ideal if that room or that area has a separate door that leads to the outside. And so those students, when their parents pick them up, can go through that exit and don't have to go through the entire school building. These are the nice things that you'd like to have. You don't always have them, and you have to work with whatever logistics present themselves.
Yeah, mine's not going to look quite like that.
No. Well, and in most of our buildings, ventilation is going to be a huge problem because our health rooms are in a center of the building. And we've got one bed in there, you've got a computer, you've got your cabinets in there to lock up some medications. So logistic-wise, we're having to go back to the drawing board in a lot of our rooms, and encouraging a sick area and a well area or a well-injured area, and you've got to take into consideration, you've still got medications to give, you've got treatments to do, and school still goes on, but all of a sudden you've got, okay, somebody's got to potentially isolate, or a staff member, there's a lot of things to think about, and our school buildings are, they're very unique. So there's going to be some creativity there.
Sure.
Michael, one of our attendees, has directed the following question to you. From a mental health perspective, how can districts help students and staff during a return to school?
It's a great question. And I shared that I had a bunch of resources that I've been developing and engaging in over the course of this pandemic time. And the first thing I think I would say, and I think this would probably be something that lots of people that have been living this would say even better from a lived experience, but from observation, I think we're living in a traumatic event. Like, we're not done with it, we're in it, we're all in it. And some people are in it to more degrees. So I think for us to do good mental health support as kids and families and teachers return, we have to find a way to have conversations about that, right? There will be people, and there are people, particularly in the Northeast and in Black and Brown communities and essential worker communities around the country, that have had many people die already from this. And that is already, rippled out into their family lives, and they didn't get to go to funerals of people they love and all that. So that's going to come to school. I was putting in the chat that we are in the midst of a uprising around racial violence directed at Black and brown people by police and by other people that think that Black lives don't matter. And that's going to come to school as well. And we're going to be in an election season, and that's going to be whatever that is. So I would say the first thing schools have to do is look at how do you respond to crisis as a school. And we've heard some great ideas about how to respond to the healthcare aspect of it. And I don't want to add much more to that because I think there's a lot of great stuff already. But I do think that schools have frameworks, whether it's the multi-tiered systems of support, the 3-tier framework, the social emotional learning framework, restorative practices. Those are all frameworks that can be tapped into so that people can actually have conversations that don't have to be therapy. They can be, let's talk as a school about how really upset we are that we didn't get to have 3 months of school, or that we didn't get to have graduation for some of us, or that I haven't seen my friends for 3 months. And then you'll have, in the 3-tier model, you'll have the kids who need more than that. You'll have the kids who, like I was saying in the chat box over there, have allergies or other COVID-ish symptoms and have a freak out in the school and have to deal with that. But all of that, I guess my last piece I would add to this is we have to have the staff to do this. And just like we have school nursing shortages, we have a dearth of school mental health professionals across the country. One of the things that is becoming very clear in this very flashpoint moment is we have way more cops in schools than counselors. Again, I think that says volumes about what we think schools are for. And we're going to have to do something about that. We're going to have to make sure that mental health is in schools come fall.
Mm-hmm. Jay.
I just want to add, though, also just to piggyback on that it's there are some school districts, and I don't know, it varies across the nation, but we have student services teams. So we're psychologists, social workers, nurses, and counselors together. And we all provide mental health services to students. School nurses are involved in safety planning for kids.
Absolutely.
And the development of the safety plan. And then, trying to find that one adult that student could go to when they're in crisis. So helping to protect students from a mental health, I think that belongs to everyone, teachers included.
Right.
But I think this is going to be especially difficult because I think all of us are going to be bringing our own personal trauma and hardships, whatever they might be associated with pandemic. And that's going to make it even more difficult, I think, across the board. There's going to be some folks that are, I worry about the people that are already worried about whether or not they have a job. Mm-hmm. Because they have a health condition, they want to work remotely. Will they be able to? Will there be allowances for those folks in our school districts that still want to work, still have much to give, but are unable to give it face to face?
If I could just add one last thing to Lisa's point, and Lisa, I didn't in any way mean to imply school nurses are mental health providers, because they 100% are. But what I think you also got at, and I want to just be really transparent about it, is you referred to teams. And I worked on a team. I'm in a state that has enough of every discipline that we can actually have turf battles because we have enough of us. Mm-hmm. But many states don't have that. Many states have a counselor or have psychologists or have school social workers or don't have anybody really other than once or twice a week. And I think what's going to become really clear is that we have to reimagine what it means to do mental health support in this time. And you're right, teachers are going to have some part of role in that. But just like teachers are going to be worried about their safety and their jobs, teachers report consistently through the research I do and many others that have done that they don't feel qualified to do mental health support. Now, I don't think that's always fair to teachers because I think teachers do a tremendous amount of support, but they're going to have an added level of anxiety about that. And so what I found through the sites work that I did the last couple months is the people that were on teams were the ones who could step back, do their own grief work, plan for a trauma-informed reopening. And those are the people that I'm going to continue to draw on over the summer because they've learned some things already.
Yeah, I think we just want the teachers to be able to identify and refer. right? And to know what they're looking at and identify it properly.
And know when to ask for help.
Yes.
That's
Exactly.
going to be an important thing. Our communities, at least here in Washington, and I'm sure all over the nation, they're really hurting, you know, and it's not going to be just our teachers and our students that we're going to have to worry about. It's the community as a whole. So.
Jay, this is a broad-based question. You could probably fill up the rest of the webinar answering it, but at any rate, as a superintendent, what do you need from the State Department of Education to mitigate health risks of your students and staff?
So that's a loaded question. You know, I think we hit on a lot of things. We need guidelines. I can tell you every district in the state's fully capable of getting the job done. However, to this point, we have no guidelines to work under. And that to me is the most important thing. And, you know, we're 3.5, 4 months into this and we still don't have anything. And, you know, to treat ESY as a summer camp, that's not a guideline. So for me personally and the superintendents I talk to on a daily basis, we need guidelines so then we can hit the ground running and get done what needs to be done before September, for whatever September looks like. So I believe that that's the most important thing. And also we talked a little bit tonight and last week about PPEs. You know, to assume that a district's going to be able to acquire everything by September with a supply chain the way it is now really is not realistic. So we would need some help from the state or the county organizations to get that accomplished, because otherwise we will not have enough to open. So, you know, for me, I think those are the two most important things. So then we can ensure that we're doing everything we can to open up safely for our children, our young adults, and our staff, because without that, there's too many questions. You know, I'm looking in the chat room and there's, you know, over 100 questions flying, and, you know, we need some guidelines so we can get our job done.
Well,
I'm sorry.
Oh, I just wanted to say, like, from a school nursing perspective, I just wanted to give a nice little plug for the National Association of School Nurses, of which I am a member. And there are some wonderful resources for school nurses, particularly when it comes to reentry and recommendations. And I know it's very difficult to make decisions from a superintendent level standpoint. I think that in some cases, everyone is waiting for someone else to make the first move. And then it seems like others follow suit. It would be nice if there was something that was outlined in a, you know, a thoughtful, predictive manner. But when that, in the absence of that, I think what we did some work in my county that involved soliciting information from parents and teachers alike, that they just could, like, go in and enter information about what they thought was very, very important to them, and what they wanted to see as part of our plans for reentry. And it was I think it really helped my district make some good decisions about how to plan for reopening. I don't think that there's a definitive answer for anything. And I think to a certain extent, it has to be, there's some level of community that has consideration that has to be made, because each community is different. So I think that's part of it too, but it doesn't make it any better.
And Lisa, I agree with you wholeheartedly. When I was referring to guidelines, I was talking more from the state.
Yes.
You know, I agree wholeheartedly. There is a wealth of information out there. I was really referencing, you know, getting some guidelines from the state on things, and that's something we haven't gotten. And, you know, we look at, there's numerous states that have put something out that people can follow. We to this day don't have anything.
as one thing I want to bring up, one thing that we're struggling with in Washington is not only that nursing support in our rural areas, but now that we've got those guidelines out and our school nurses, our school nurse organization of Washington worked really hard to get a seat at the table at the state level. And one of the things that we're seeing now is that at the district level, there's so many things that superintendents are having to worry about and so many things to consider coming back to school that sometimes they forget to invite the school nurse to those planning teams. And so for all the superintendents on this call, please don't forget your school nurse.
Well, Liz, your ears must have been ringing because today I had a conversation with my leadership team at central office, and my assistant superintendent came in and said, our head nurse is going to take a job for the summer. And we said, well, she can't do that. She's going to need to be here helping us all summer. So your ears had to be ringing because I had that same conversation 8 hours ago today. So I'm happy to say that our head nurse will be with us all summer planning for everything for September.
And I'm a little nervous. I hear in Massachusetts every once in a while some murmurs that because of budgets, which everybody's struggling with, that sometimes school nurses are afraid themselves of being furloughed.
Yeah.
And obviously that's a huge problem because this is the time that we need more of them and not less.
Yeah.
So I definitely feel that this is the time that collaboration is important. Most communities, not all, have some local health experts that are probably underutilized, and school nurses are at the top of that. But there's also nurses in doctors' offices and such who can bring a lot of practical advice to the table. And for every person who's on this panel, there are state resources, and those are the people who care just as much as we do, that are being left out of the table. And we understand the table shouldn't be too big, but when we get down to implementation, these are the people who know the community and who can say, I heard from the Massachusetts School Nurse Organization, somebody asked the question, if somebody questions wearing a mask, will the pediatrician be the one to give them exemption? And my heart fell because I thought, just like you all think about all the things you have, thought, well, we need to be at that table, right? Because we have the community pediatricians, and it could be a lot of little working groups, but we all need to be working together and supporting each other in our areas.
Absolutely.
Sure.
Mary Beth, one of our participants asked specifically to pose this following topic to you. They're looking for guidance on contact tracing and antibody testing.
Okay. So contact tracing, every state there, I wish I had the link right now, but I saw a picture of the US and which states were actually up to snuff in having enough contact tracers. And unfortunately, I don't really know where some of my panelists are from New Jersey. I don't know where every state was. I was happy to see that my state was at least on par, which is probably still not enough contact tracers. That's going to be huge because if I were a school administrator and a school nurse, the first group I want to reach out to is the contact tracers, right? So that I'll know, A, what is the level of transmission in my general community, and then what's going on in the groups in my school. So that will also include those teachers and the parents and all the high-risk individuals. So that's going to be another person or organization that needs to be at a school's sort of hotline, red phone to call and know who to reach out to. Antibodies, I would not at this point be relying on antibodies. The general idea is that people think lab tests in medicine are sort of a yes or no answer, and particularly antibodies are not. And we do not have a general idea of what level for all of the many antibody tests that are out there, and there are a lot of approved antibody tests. We don't have the cutoff levels that say this individual has the antibodies that means that they're immune. So we shouldn't be relying on that on an individual basis. We can, on a community level, growing basis, say, well, what percent of our community have antibodies? But that's a population health issue. And I wouldn't be relying on that too much. I want to put in a plug for the vaccine issue too. So I'm a big proponent of vaccines. I don't think you can find somebody who's more of a proponent. But one of the reasons I'm a proponent of vaccines is that we have a really rigorous vaccine clinical trial program. And I wouldn't want, I have patients who say, I'll come to the health center when the vaccine's ready. Like, well, I'd like you to bring your child for a physical sometime before that, because we don't know how quickly the vaccines will be ready. And if you talk to Dr. Fauci, he's more realistic. We're talking about next year. And that's the beginning of the trials. We can't be waiting on those vaccines any more than we can be waiting on antibody tests for our kids and our adults. So we need to be going to the basics that we've talked about, the social distancing, the masking, hand washing, gloves. And I probably, in my own way, am the most confident on this panel that we can do this. I truly think we can do this, but we can't rely on the medical technology that's not where it needs to be, or we will have false hope, which is worse than.
As our town hall draws to a close tonight, I'd like to ask each of our panelists, in 60 seconds or less, to provide us with a closing thought, starting with Lisa.
Well, I think that in general, we need to have, we need to keep grace in mind as we move through this process, and realize that we know that we'll make mistakes, and beg for forgiveness as we go along. We hope that those mistakes will be little ones, and our focus will be to keep students and staff safe.
Liz.
You know, I tend to agree with Lisa. You know, there's no 100% guarantee. And we need to keep that in mind, not only as teachers and educators, but families and staff members. And the one thing that I want to encourage everybody is, as we're going through this, we're coming into this fall, is to ensure that we're taking care of ourselves. You know, and some time out for ourselves just to regroup or whatever we need to do, because we've got a rough road ahead of us, you know. So, yeah, I agree with Lisa, a little bit of grace, and yeah, some time to ourselves will be good if we need.
Thank you. Mary Beth.
What I've learned in the last 3 months of working sort of right on the front lines, as well as trying to coordinate with schools, is that uncertainty makes all of us professionals nervous, slightly different ways. And so that COVID is something to take seriously, but that preparation and rapid response can make it less fearful. And I think we're all coming together and saying we just want that preparation and guidelines, but that communication and collaboration is actually there. And the people who are sitting around on this panel, there are people like this across the country and in many communities. And that I actually feel that when I look at the changes every week, there is more information, and we have to sort of muck through it with the best and the brightest and the most committed to children and communities. And I actually think that with preparation and rapid response, we can do it.
Jay.
Well, I completely concur with everyone so far, and I would add that, you know, we are in the middle of something horrible, and it sometimes may be difficult to get up in the morning, to walk out that front door, but I encourage everybody to get up every day, go out that front door and lead and be a difference maker in this, because of all the people on tonight, you're all leaders and we all need your help. So I encourage that.
And Michael, bring us home.
All right. So it's been an honor to be here. It's been great to learn from everybody. There's three groups I think of tonight. One are the scientists and the people on the front lines doing the work and finding it out through the practice experience, the wisdom in the schools and the school leaders and the parents and the kids, and the policymakers and the politicians. I am very confident that the science and the practitioners and the wisdom in the schools are going to do the job. I think it's our job with those two groups to make the third group do their job.
I'd like to thank our outstanding panelists for their time and expertise, and we invite everyone to join us again 1 week from today for another town hall at 8 p.m. Eastern Standard Time. Our topic, Medical Guidance for School Reopening Part 2, an expert panel of epidemiologists, nurses, and superintendents that will be providing key guidance on COVID-19 and considerations for school reopening. Thank you all so much for being with us tonight. Until next week, be safe and be well.
Good night, everybody.
Good night.
Night.
Good night.
Thanks, everyone.
Everybody.
Thanks, everybody.